guys, my name is Maggie and today we are going to be talking about having my period without a colon, rectum, or anus. Yep, we're doing it. So, yes, we are going to talk about life with not a colon or a rectum and my anus being shut. That is truly my life, and when I make these videos, I tend to get viewers that are outside of the disease population that I often speak to. So I am going to give a little bit of a backstory of how I got to this point, because I know that there are people very curious and confused at why I would ever go through with a surgery like this. It seems pretty insane to people who've never heard of it. And yeah, when I had never heard of it and then finally heard of it, I kind of freaked out a little bit. And this backstory is to the very few extremely uneducated people who tell me things like, if I drank unicorn tears on the third Tuesday of every month for a year, I would have been cured and I wouldn't have had to go through this. I work in the medical field, I research all the time, I've tried just about every treatment out there, and this is the thing that helped me the most. So remember, we have patients that are watching this video that are very curious about this, and that's why I want respectful comments. I don't accept not respectful comments. I do accept jokes. Like when people say, wow, what a way to get out of anal sex. That's kind of funny. I know, some people might find it offensive. I don't, I think it's... Anyway, let me give you the backstory. So I'm 27 years old currently, and when I was around 11 years old, I started having some weird symptoms, losing weight, couldn't eat, just overall not feeling well, abdominal pain, and I wound up getting diagnosed with something called Crohn's disease, which affects your GI tract all the way from your mouth down to the anus. I tried different treatments, I tried different diets, like I did tube feeding for a while, and none of it really helped. And what happened was my intestine became so scarred, irreversibly scarred, that I had to get portions removed. This led to me needing an ostomy bag. I have so many videos about ostomies and what they are and what they do and why people get them that I have on my channel, so please check them out if you're curious. But essentially, the ostomy was a way to use my small intestine and divert it away from my large intestine or my colon. That way my colon could have a break, my rectum, my anus, all could have a break. And what wound up happening is it kept deteriorating anyway. The disease was still active there, but I felt pretty okay because I was then able to eat and just use my small intestine. And I adapted pretty quickly. I lived for 10 years like that with just a disconnected colon, and eventually got to the point where it was so diseased and so scarred, and the colon was producing this awful mucus, which is normal when you're connected, but it's not a great thing when you can't get it out because of all the scar tissue. So it kept building up and making me feel really bad. So I made the decision December 2019 to get the shebang out of there. And it was a very rough surgery, but I knew that. I prepped myself going into it. So I knew what to expect coming out, and I was able to care for myself. It's very painful, it's awkward because you've got stitches in places that you can't even see on yourself, and you have to rely heavily on whoever's around you to basically do wound care on your butt. Luckily, my husband was more than willing. But, haha, they did not tell me a few things about this surgery, and I have a great surgeon and great surgical team who did this surgery. I think they did amazing on it, and they just weren't aware of some of the things that could happen as a complication of this surgery. And it wasn't until I did some research, there really isn't a whole lot out there on this, but also hearing from friends who were either going to have the surgery or did have the surgery, that I felt like validated. So here's where we get to the period part of this. And it's not just about that. It's more women's health with this surgery. Very soon after surgery, I started having vaginal discharge. I'm sorry to the men watching this, but vaginal discharge that was just unexplainable. We couldn't figure it out. We kept testing me for different infections, different funguses. Nothing was coming back. It was saying, nope, you're good. Like, this is not an infection going on. And it was so annoying is all I can say. Is I would stand up and I would have this giant rush of discharge, which is super gross. And I had to wear a pad, like all the time I did. I didn't know what the heck was going on here. So I went to my surgeon, I went to my gynecologist, I went to anybody I could think of to see what in the world is happening. So nobody could really tell me. They just said, you know, we can try some steroid suppositories and things of that nature. And I was like, it doesn't make sense. It was not until I got on the phone with my friend who has not had this surgery, but was talking about getting this surgery. I think she's probably experiencing some of the same annoying symptoms of having you know, a rectum and colon just sitting there not doing anything. And her surgeon had warned her that it could affect you gynecologically. And that has to do with the fact that your rectum is a huge support to your vagina. Yep. Wish I would have known that before going into this. I mean, it makes sense, but you know, you're not thinking about that. You're thinking about getting rid of your colon and rectum and like, okay, the GI system is what's being affected here. You don't think about the other systems that may have a problem afterwards. So because your rectum is that support for the vagina, when you take the rectum away, the wall of the vagina can kind of tilt or collapse, which results in pooling of any discharge. So as soon as I heard that, I messaged my surgeon. I was like, listen, I think I figured it out. I think I know what's going on here. And he said, you know, that is very plausible based on what we took out and where it was. And during my surgery, they did find Crohn's disease on my vaginal wall that he had to scrape away. So I started tracking my cycle because I was like, if this is happening, if I'm getting this pooling effect where, you know, if you sit for a long time, it pools and then you stand up and it all flows out, it shouldn't just happen with the discharge. It should be happening with my period as well. And when my period started to become normal again after the stress of surgery, I realized that's exactly what was happening. My period used to last maybe 5 or 6 days, whereas now I bleed for around 8 days, which is kind of irritating, but it is what it is. And when I got my period, I would have nothing come out for hours and then suddenly a whole lot of blood. Like a lot. Which the first time that I had that happen, I was in the shower and suddenly it all came out and I screamed. I was all, you know, I got woozy. So I was like, oh my God, that is a ton of blood coming out of me. What the heck? It was just my period starting, and it probably had started a number of hours prior to that moment, and it just collected and suddenly de-pooled out of me. So, they don't tell you this. That's the thing, is when you go to research this, there is really not a whole lot online. I found one article, I had to pay for it, and it just very broadly said that women experience an increase in discharge post-op proctocolectomy. I was like, well, no, duh. What I did notice was my surgery was December 2019. A few months went by. It was like 3, 4, 5 months when I started to notice a vast improvement where it started to go away and the discharge was less and less. My periods would be a little bit more dispersed than, you know, kapow, and then nothing, and then kapow. But then, July of 2020, I went in for my kidney surgery, which I've well documented on my channel, and my surgeon found that I was filled with scar tissue just everywhere. And so he cleared me out of that. And after that surgery, it came back. I think I had maybe some scar tissue supporting the vaginal wall that was maybe helping, and then he cleared it out, and now it's like back to square one. It takes a while for scar tissue to develop, so I'm not really sure that's, you know, a connection, but I'm hoping that, you know, as we get further and further away from my last surgery, I'll have some sort of improvement in this. One thing I'm looking into is pelvic floor therapy to see if I can strengthen the muscle wall at all, do some exercises so that way this hopefully improves, because it's really irritating when, you know, you don't even know you have your period and then suddenly it's there and you have to change your clothes because it just explodes. And then once I get that rush, I'm like good for a few hours. It's kind of funny. Some of you may ask about tampons. So what I will say is that tampon use after this surgery, because they're just so close together, I could not put a tampon in for a few months. It was very painful. You're stretching your new wound. I can now, but it's still a little bit tender. And even when I do, if I get this rush, it doesn't give it enough time to absorb in the tampon, so it comes out anyway. So the pads with wings have been my friend. So yeah, that's my story. That's what's been going on. I would really love to partner up with like doctors or nurses to be able to research this particular topic, because there is so little information about this. Like, I don't know if anybody's done any studies on gynecologic issues after proctocolectomy surgery in women, because they're intense and nobody tells you about it because they just don't know. It seems like only a few surgeons are aware of this. Maybe I'm wrong about that, but my surgeon did not know about this. And I'm finding from the friends that have had this surgery, they experience this. Becky Bauman from Becky Talks Butt Stuff on Instagram, she just spoke about this in one of her posts, and I was like, yes, like that's me. But that has been my longest side effect from the surgery, the most annoying thing I would say. Let me know if you've had this surgery, proctocolectomy, pan-proctocolectomy, colectomy, what else can we call it? Whatever you want to call it. Let me know if you've had this surgery and had these symptoms in the comments below. If you're on this video and you're like, what the heck is this girl talking about? Please look at my other videos on my channel. I have a lot explaining my history with this disease, this really annoying disease. Alright guys, thank you so much for watching, and I hope that I see you in the next.